just wanted to give you an update on a new procedure that I did a few days ago. I've been doing patellofemoral, so partial knee replacements for arthritis behind the kneecap for 20 years, and I've been really happy with my outcomes. But there's always been the challenge of doing this procedure in someone with abnormal anatomy. And especially for arthritis specific to the kneecap, a lot of that is due to congenital anatomic variance where the kneecap is what we call dysplastic, so it just has a different shape, and that makes it very difficult to fit a regular off-the-shelf replacement to the patient's anatomy. So this is a procedure that has become available in the US only recently, and this was the first case actually in New York of this particular implant. So what they're doing, which is different from the standard operation, is what you can see here on the right side. That's an MRI scan of that specific patient, and they are creating a 3D model of the patient's knee, which is really neat for someone who has a very abnormal anatomy. So what you see on these two slices, in blue, they're mapping out how they want to shape and fit the custom implant for the kneecap, the patella, and then in red you can see the same on the opposite surface, so on the trochlea. And they're going through this MRI scan slice by slice to create what's called a damage map of the knee joint itself. They go slice by slice and create this 3D map of the knee joint, and they do what's called a damage marking. So what you see here in like the dark red for the femur and the patella, that really shows you the areas of worst damage. And they want to make sure that the implant they designed covers all the damaged areas, which in her case was a little challenging because of her abnormal anatomy. Based on this damage map, they custom make an implant, and that's what you see on the bottom right. So this is just essentially the CAD design for the femoral component, which is made from metal in red, and on the right side the patella or kneecap component in blue, and that's made from a polymer plastic. They not only give you the implants themselves, but also a much more precise means to put them in. So what you see on the top right, I'm holding the 3D models. So at the bottom you see a 3D model of her patella, and it is a tiny patella. And then on top you see this custom guide, and on the right side, as I engage the custom guide with the patella, you can see how that fits perfectly. So you have this custom guide, it's sterile. In the operating room, you put that on the patella and on the trochlea, and it fits just one way. You hold it with pins, and then you can prepare the patella and the trochlea to accept the implants. And you place the implant with a little bit of cement, almost like a dentist putting a crown into place, and it fit perfectly. So I was really happy with this procedure. I'm looking forward to using this more. Thanks for your time. I'll talk to you soon. Bye-bye.